Vision begins when light enters the eye, but in conditions like myopia or nearsightedness, the irregular shape of the cornea causes light to focus in front of the retina rather than directly on it, resulting in a blurred image. LASIK vision correction offers a precise, permanent solution to reshape the cornea and correct this refractive error. To understand the procedure, we must look at the corneal structure. The cornea is made up of distinct layers: the outer epithelium, Bowman's layer, the thick central stroma, and the inner endothelium. The stroma is the target area for this surgery, as its stable tissue allows for permanent reshaping without disrupting the eye's structural integrity. The procedure begins with the patient lying comfortably. A sterile lid speculum is gently applied to keep the eyelids open and prevent blinking. Anesthetic drops are administered directly onto the eye's surface, ensuring the patient feels no pain throughout the surgery, only a sensation of slight pressure. To guarantee absolute precision, a suction ring is lowered onto the sclera, the white part of the eye. This device gently stabilizes the globe, preventing any movement during the critical initial steps. The patient's vision may dim momentarily as the pressure secures the eye in position. Instead of a mechanical blade, a high-tech Femtosecond laser is used to create a corneal flap. The laser emits ultra-fast pulses of light that pass harmlessly through the outer surface to a precise depth within the tissue, creating a layer of microscopic bubbles that define the flap's dimensions. With the laser work complete, the surgeon uses a delicate instrument to slide under the laser-created edge. The hinge flap is gently lifted and folded back like the cover of a book, exposing the underlying stromal bed where the vision correction will take place. Before the correction begins, the system's advanced eye tracking technology locks onto the pupil. A digital grid monitors the eye's position thousands of times per second. Even if the patient twitches or moves slightly, the laser adjusts instantly to ensure the treatment remains perfectly centered. An Excimer laser is then activated to reshape the cornea. Using cool ultraviolet light pulses, the laser vaporizes microscopic amounts of stromal tissue in a process called ablation. Each pulse removes a tiny fraction of tissue, flattening the central curvature of the cornea based on the patient's specific prescription. This topographical change is calculated to the micron. By flattening the steep curve of the nearsighted cornea, the laser effectively modifies the eye's focusing power. The new, flatter profile corrects the refractive error, allowing the eye to manage light more effectively. Once the reshaping is complete, the hinged corneal flap is carefully guided back into its original position. It floats on a thin layer of fluid before settling perfectly into place, naturally aligning with the untreated edges without the need for stitches. The surgeon gently smooths the flap from the center outward using a soft surgical sponge. This action squeezes out excess fluid and eliminates any air bubbles or wrinkles, ensuring the flap adheres securely to the underlying stromal bed. Natural adhesion occurs rapidly. A high magnification inspection reveals that the flap edge is seamless and the cornea is clear. The epithelium begins to seal the edge within hours, creating a robust barrier as the eye heals naturally. The functional result is immediate. Light rays entering the newly reshaped cornea now bend at the correct angle to converge precisely on the retina. The focal point is shifted back to the optimal position, eliminating the blur of myopia. For the patient, the world comes into focus. The dependence on glasses or contact lenses is removed, restoring clear, 20/20 vision and significantly improving quality of life from refractive error to perfect focus. LASIK represents the pinnacle of laser eye surgery. Thank you for watching this visualization of vision correction.